Struggling with pain around your lower back and hips that just won't quit? Your SI joint might be the issue. My name is Faris Solomon. I got my degree in the study of human movement, and I'll go over the common causes of SI joint pain and 6 exercises to treat it. Let's go. The SI joint connects your spine to your pelvis, making it an important structure that helps transfer the forces and weight from your upper body to your lower body while maintaining stability. For many people, SI joint pain feels like a sharp or dull sensation, usually affecting the lower back, hips, and butt, and is typically on one side. Now, the SI joint itself has little movement, but even slight dysfunction, such as too much or too little motion, can cause significant discomfort. The common causes of SI joint pain include trauma from falls or accidents affecting the pelvis, repetitive stress from high-impact activities like running and heavy lifting, pregnancy due to the altered posture that can affect the SI joint, muscle imbalances, especially if it's affecting the core, glutes, and hips, which can increase the stress on the SI joint, poor posture, which can be from leg length discrepancies, arthritis, or prolonged standing or sitting in any one position, which adds unnecessary strain on a joint. To treat SI joint pain, the focus is on reducing discomfort, restoring normal motion, and increasing the strength of the surrounding muscles to reduce the strain on the joint. That's why exercises such as single leg deadlifts and lunges will be avoided, because they are not ideal for SI joint pain due to the twisting forces on the pelvis that causes uneven stress on the joint. Now, the exercise program should be performed between 3 to 4 times a week with 1 to 2 rest days in between. Let's get started. The first exercise is Abduction. Adduction. Lie on your back with your knees and hips bent at 90 degrees and a belt around your thighs, just above the knees. Now apply pressure as if you're trying to move your knees out against the belt. Hold that contracted position for 3 seconds. That's 1 rep. Go for 5 reps. Next, for the adduction part of the exercise, form a fist with both hands and place them between your knees. Start applying pressure, pushing inwardly into the fist, and hold for 5 reps of 3 seconds each. This exercise strengthens the hip muscles and inner thighs, promoting pelvic stability and reducing excessive stress on the SI joint. The second exercise is rotation. Lie on your back and bend the leg of your painful side while keeping the opposite leg straight. Rotate your foot of your bent leg inwardly and place it under the knee of your opposite leg. Now grab the outside of the bent knee with your opposite hand and slowly rotate towards the pain-free side while keeping the shoulders on the floor. Hold the stretch position for 5 seconds. That's 1 rep. Go for 5 reps per side. This improves rotational mobility and reduces stiffness in the lower back and pelvis. The third exercise is kneeling rotation. Kneel with the leg of your painful side on the edge of a bed or bench. Now with your opposite leg, go over the back of the foot and slowly start lowering the unaffected leg over the edge of the bench. Hold that stretch for 5 seconds and pull your leg back up. Repeat this for 5 reps per side. This opens up the hip flexors to help improve rotational control, which is essential for reducing SI joint strain. The fourth exercise is push-pull. Lie down and have your knees bent, with a golf club or a similar sturdy object placed under the knee of the painful side and over the other knee. Now lift both feet off the ground, stabilize the golf club with your hands, and push down with your painful leg while pulling up with the opposite leg. Hold that position for 3 seconds. That's 1 rep. Go for 5 reps, then switch sides. This helps relieve pain in the SI joint by working on balancing forces across the pelvis. The fifth exercise is bridges. Lie on your back with your knees bent and a resistance band around your thighs, just above the knees. Engage your glutes, lifting your hips off the floor while also pushing outwardly against the resistance band. Hold that position for 1 to 2 seconds. That's 1 rep. Go for 2 sets of 15 reps. This strengthens the glutes to improve the stability of the pelvis to directly address SI joint instability. The sixth exercise is ball squeezes. Lie on your back with your knees bent and feet flat on the floor. Place a ball between your knees and squeeze the ball gently but firmly and hold that for 5 seconds, then release. That's 1 rep. Go for 2 sets of 10 reps. This activates the adductor muscles to help improve pelvic alignment and reduce excessive movement at the SI joint. Now, to prevent SI joint pain from reoccurring, here are some helpful tips to follow. First, avoid uneven weight distribution by being mindful of uneven surfaces, especially when carrying heavy objects or lifting. Second, maintain good posture and avoid being in any one position for too long, which can increase the stress on your lower back and pelvis, and this can be avoided by mixing up your position often. Third, strengthen your core, glutes, and hips to increase stability and maintain proper weight distribution, while also being consistent with stretches to maintain flexibility. SI joint pain can be limiting, but with the right exercises and habits, recovery is within reach. Remember to stay consistent with the exercise program while also giving your body enough time to recover. So as always, stay active and mindful.